My name is Haline Grublak, and I am the Director of Advocacy and Peer Services at Solvista Health. Solvista Health is a community mental health center that serves 4 rural counties in central Colorado: Lake, Fremont, Custer, and Chaffee. And I've worked here for 5 years, but I've worked in behavioral health since actually the early 70s. So I've worked in behavioral health almost 50 years. So when I was in my early 20s, I had an episode of severe depression that actually resulted in a hospitalization. That's not uncommon. A lot of people experience mental illness, their first episode, when they're in their late teens or early 20s. And I recovered, or I did a good job of recovery, but that, I think, inspired my interest in behavioral health and wanting to help others, because there were people that helped me get better, and I wanted, help me get better, and I wanted to help others also, move on their recovery journey. When I was in my mid-20s, I started working at the state hospital in Colorado, and it was a very progressive program. They were using something called patient counselors. Basically what they were in today's world were peer specialists. They were people who had experienced a mental illness or substance use disorder and were actually helping others who were at the time hospitalized. And what a peer specialist is it's a person who has a personal lived experience with either a mental illness or a substance use disorder, and they use their life experience to help others. In Colorado, we get specialized training and do internships and use that experience as someone with lived experience to help others. There's some things that peer specialists can do that a trained clinician might not be able to do. For example, there was a person that had asked a clinician, I hear voices, what do I do? He didn't want to learn how to process his experience. What he wanted was very specific, concrete ideas about how he could deal with his voices. Somebody who's heard voices can share that information. They can help, Using peers was very cost effective. The research said that people with lived experience, some situations, was as effective as using professionals. So for our industry, which is, we're always over capacity, we always have more people to serve than we have people to serve them, you really want to maximize your resources. So from the financial perspective, it was a great way to maximize our resources, that, you could hire maybe 2 or 3 peer specialists for 1 clinician. And that's like peer specialists at the probably beginning of their career. Because I also want to say that being a peer specialist isn't just an entry-level position. There are multiple levels. People can do this as an entry level. People can do this as administration. People have been program directors. I actually have a colleague in the northern part of the state who is a licensed clinician. She chooses to work as a peer specialist because she has lived experience, and she believes that she can use those tools in a better and more effective way than she can use the clinical tools. That's not to say everybody's like that. It's not to say that peer specialists replace clinicians, because that's not true at all. Ideally, they work side by side. They just have a different set of tools that they can use. It did surprise me. My academic training is in business and organizational leadership and management, and so sounds pretty far off from being a peer specialist, but I always seem to land in behavioral health because that's kind of who I am, recognizing that, the emotional part of our composition is so important to who we are and to our happiness. It's not just about money or success, but about understanding yourself and understanding your feelings and understanding why you act the way you do. I want to help people. I know that when you've been saying it for almost 70 years, it sounds kind of trite, but that's really what I want to do. And I think that working in this role has allowed me to do that. And there were opportunities because it was a way that I could use my creativity and some of my other skills, my leadership and organizational skills to bring people together to advocate to using this, because at one time professionals were very opposed having peer specialists on staff. Professionals thought it was, and not just professionals, even sometimes family members, were opposed because, you're just providing us with subpar care. You're just, we don't qualify to talk to a real therapist. And it's not that at all. It's that with that professional perspective and then also with that lived experience perspective, you have a better, more well-rounded set of services to help somebody reach their happiness goals or their wellness goals. There's also a social justice component to it too, because people with mental illness, people who suffer with substance use disorders are disenfranchised, they're discriminated against, and they're not offered the same kind of opportunities for success in our society.